there.
Hi.
How are you doing today?
Good, how are you?
I'm good, thanks. My name's Lauren. What's your name?
It's Matthew Molson.
Hi, Matthew. And I see you've been to the pharmacy before.
Yeah.
Can I get your date of birth, please?
Sure, it's February 28th, 1963.
Great. And an address?
123 Fox Drive.
Great. What can I help you with today?
Well, I was just at the doctor for my annual checkup, and he told me that I have an enlarged prostate.
Oh, okay.
He said there's some medications that I could take for it, but I wasn't too sure, so I just figured I'd come and ask what you thought I should do.
Great. That's a good decision. I'm glad that you did that. Okay, before we get into that, I just want to check, you're taking Synthroid?
Yeah, for my hypothyroid.
Okay, great. And do you have any medical conditions that I should be aware of?
Just that one there, the hypothyroid. Yeah, nothing else.
Okay,
Yeah.
great. I have this brochure here.
Oh, okay.
This is all about enlarged prostate. It's also called benign prostate hyperplasia, so that's what BPH stands for.
Oh, okay, sure.
Yeah, this is just going to give you some benefits and risks of the different options. So you wanted to know about medications.
Yeah,
that's going to
for
go
sure.
through all of this.
Okay, perfect.
So do you have a few minutes to go through this with me?
Yeah, for sure.
Great. Okay, so tell me what you know about enlarged prostate.
Well, he said that it was swollen, and then that's why it was making it hard for me to go to the bathroom.
Okay, so
Yeah.
you're having the symptom of not being able to go to the washroom.
Sort of. I didn't really even notice it until he had said something, and then I said,
Okay.
well, I guess that kind of makes sense, because I think I've woken up a couple of times at night, like maybe once every couple of nights I'll wake up and have to go to the bathroom. Not like a big deal or anything. Like, I
Okay.
wouldn't have even noticed had he not told me, but yeah.
Okay,
So,
all right. Well, yeah, that's definitely true. Enlarged prostate can decrease urine outflow, and
okay.
so that's probably why you're experiencing that.
Yeah, it makes sense too if it's decreasing, because I was having some trouble, like, I feel like I have to, like, force it out. It's
Yeah.
kind of like weak, I guess, is
Okay.
what I would say. And then, yeah, so that makes sense too, for
Yeah,
sure.
that's definitely a symptom.
Okay.
Okay, so before we get into this, what would you say your goals are for going forward? Like whether or not you're on medication, what do you want to do?
I guess I don't really like pills all that much, but I mean,
Okay.
I'm kind of used to it already, so as long as it's helping, I wouldn't really mind pills if I have to.
Right.
Yeah.
Okay, great. All right, so let's start going through this together. BPH or enlarged prostate is not cancer, so
Right.
you don't have to be worried about that. Like we already talked about, it can harm urination, so it seems to be that you're experiencing that. Other than that, it is quite harmless, so
Okay.
nothing to be too concerned about. As men age, it's fairly normal.
Okay.
So yes, a lot of men get it. There's two medications that we generally use. One is
Okay.
called the alpha blockers, and then the other is 5-alpha reductase inhibitors.
Oh, okay.
Fairly long names, but
Yeah.
you don't need to remember those.
Sure. Okay.
The alpha blockers, those are essentially just going to relax the muscle around your bladder
Okay.
and around your prostate.
Okay.
The 5-alpha reductase inhibitors, those are actually going to shrink the size of your prostate.
Oh, okay.
These ones work a little more slowly. It takes about a few months.
Okay.
And these ones are going to work more.
Okay.
There's also combination therapy that we can do. That's for more severe symptoms, so it doesn't sound like you have that yet.
Yeah, it doesn't seem like it.
Okay, so we'll probably leave that out of the picture for now, just
Okay.
so you know.
Sure,
If
good
it
to
ever
know.
gets worse in the future, then
Yeah,
we
for
can do
sure.
that. Okay, so these are just some medical conditions that can possibly interact with this poorly, so I just want to double check. that
Oh,
you don't
okay,
have
for
any.
sure. Yeah.
So fainting after or during urination?
No problems with that.
Kidney or liver problems?
No.
Low blood pressure?
No, it's pretty good.
Prostate cancer?
No, he said I do not, so.
Okay, and low urine flow, you said that?
Yeah, a little bit. Yeah.
Okay, we'll check that off. And
Not
any-
too bad, but a little bit, I guess, maybe.
Right. Okay, well, we'll just check that off. This is something that you can also take to your doctor, just
Sure.
so that he can see what we've discussed.
Okay.
And anything else you'd like to talk to me about?
No, that's really it, yeah.
Okay. All right, let's start going over some of the benefits and risks of both sides.
Sure.
So with medication, this would be something that you would probably take long term.
Okay.
So benefits, you're going to see the benefit fairly quickly. So it's going to help shrink the size of your prostate, and you're going to see increasing urination.
Okay.
On both ends, whether you take medication or not, there's going to be some new urination techniques.
Okay.
So just, learning how to relax when you go to the bathroom,
Okay.
and, so just to increase your urination. On the no medication side, 4 out of 10 men do get better without medication.
Oh, okay.
So pretty good stats.
Yeah.
On the risk side of both, with the medication, there might be some dizziness. Also, sexual dysfunction is a side effect in some men, but it's a fairly low stat. It's about 6 out of 100.
Okay, yeah, the doctor told me that might happen, so that was a bit concerning
that
for me.
That concerns you a little bit? Okay. I will make note of that, and we have a little thing on the next page that we can fill in all of your concerns.
Okay, sure.
Okay. And yeah, so that about covers that. What questions do you have so far about risk
I guess
benefits?
maybe if you could go into how much people have the sexual dysfunction, that
Okay.
kind of stuff, and really
Yep.
like what that means exactly. I'm
Right.
not too sure.
Okay, well, essentially what that means is men have a difficult time getting an erection or with ejaculating.
Oh, okay.
So those are the two main ones.
Okay.
But so on this page we have some pictograms just showing you some of the stats.
Oh, okay, that should make it easier.
For the sexual dysfunction, which seems was one of your concerns.
Yeah, for sure.
It's 6 out of 100 for on medication and 2 out of 100 for no medication.
Okay.
So they're both quite low.
Right. But
So
there's a little bit of a difference.
There's a
there.
little bit. Yeah, so that's definitely something to take into consideration when you make your choice.
Sure.
Other than that, how many men get better? 6 out of 10 for medication, 4 out of 10 for no medication.
Okay, so pretty close there.
Pretty
a little bit
close.
of a difference.
Yeah.
But yeah. Okay.
And how many men develop acute urinary retention, which just means the not being able to go
Oh, okay.
to the bathroom? 3 out of 100 for medication,
Okay.
and 7 out of 100 for no medication. So that one's a little bit higher on the
Right.
medication,
Okay.
which also is one of your symptoms.
Yeah.
Okay. So what questions do you have about that?
I think it makes sense that there's sort of like that's the difference between the two of them. So yeah, I think that for sure makes sense.
Okay, let's start rating some of the
Sure.
things that are important to you. So how important is it to you to reduce your symptoms?
Like really, like I said, I didn't really notice too much of it before he even said anything, so probably not too big of a deal.
Okay, so
like,
maybe
like something later on. I'd say maybe like a 1 or something.
Okay.
Not too big of a deal. Yeah.
how important is it to you to live a life without taking medications? You said that wasn't a huge one.
Yeah, like I'd be able to deal with it if I needed to, but I'd rather not take them if I didn't have to. So that would be somewhere in the middle there. Yeah, sure.
Okay. And how about to avoid the side effects of the medications?
Yeah, that sexual dysfunction one's kind of making me a bit nervous. That'll probably be on the higher end of the scale, like a 4 maybe or something.
And this one is actually quite specific to that, so to maintain sexual function.
Okay, yeah, that'd be the same. Yeah, like a 4 or 5, somewhere in there.
Great. So at this point, after hearing that information, do you have any preference towards medication or no medication?
Well, what do you think I should do?
You know what? I want to pick what's best for you, and I want you to, at the end of the day, make that decision for yourself.
Okay.
Yeah, so both options are very viable. It just comes down to what you prefer.
Okay.
Do you want to...
I'm a little bit hesitant to take it because of the side effects. Would it be okay if I maybe talk to my wife about it or something like that?
So let's put I don't know right now.
Okay, sure.
Okay. I just want to, this is just a little quiz.
Okay, sure.
So let's just go through that together. I just want to make sure that I've given you the information you need to hear.
Sure.
So which option has the highest chance of reducing the size of your prostate? Would it be medication, no medication?
Medication would be better, yeah.
Great. Which option has the lowest chance of improving urination?
I guess nothing. So no meds.
Yeah. And which option has the lowest chance of changing your sexual function?
Medication seems like.
Okay. And which option has the highest chance of dizziness?
Well, you'd said that, medication could cause some dizziness, so I guess I'd say that one is medication too.
Great. Awesome. Good job. What other questions do you have about that?
I guess you kind of answered all the things I came in with, like sort of the differences between the medication and no medication. But yeah, with what you were saying with the side effects, it does make me a bit nervous. So, but yeah, maybe I'll talk with my wife. We'll see sort of what works best for us, and I can get back to you, I guess.
Yeah.
Okay.
Totally. And that's really fair, and I understand your concern on that, and something that you want to take into consideration with these medications. So, okay. Finally, I just want to check how comfortable you're feeling with these things. So, do you know the benefits and harms of each option?
Yeah, I think I got a pretty good idea of what's going on.
Okay. Are you clear about what the benefits and harms of each?
Yeah, I think so.
Do you have enough support and advice to make a choice?
Yeah, I think my wife and I can probably get something figured out, and then if I have any other questions, I'll give you guys a call or something like that too.
Awesome. And how sure do you feel about making a choice?
I think once we talk it over, I think I'd be able to come up with something.
Okay. I'm going to leave that one blank for you to fill out.
Sure.
And then this is just after you have made a decision, you can just fill in one of these boxes deciding which medication.
Okay.
And yeah, to draw.
Sure. Okay. All right.